The word leukemia comes from the Greek word leukaemia, which means white blood. It takes place when the bone marrow produces stem cells that develop into an excessive amount of white blood cells.
Leukemia, it's usually referred to as cancer of the blood, but that's slightly misleading. It's actually a cancer of the tissues in the bone marrow where all the blood cells are made. Its main effects are seen in the blood, and the biggest problem is usually not the leukemia cells, the cancer cells themselves. It's there not being enough red blood cells, so people become anemic, they become breathless and easily tired.
The first case of leukemia is not really known, but the illness was discovered in the 19th century by a Scottish doctor.
Leukemia has probably existed as long as people have. It's found in non-human animals as well. The first reports are generally agreed to have been written by a German doctor called Rudolf Virchow and a British doctor, Scottish chap called John Hughes Bennett in the middle of the 19th century. Those are the first ones we can really tell that it is leukemia they're describing.
The most common symptoms of leukemia are anemia and frequent infections. Tiredness and loss of appetite are also typical.
People will become anemic, they'll get pale, they'll get tired very easily. They will tend to get bruises and they may get some bleeding. And they will be much more likely to get infections, and those infections will last longer.
Anyone from human beings to non-human living beings could develop leukemia. The causes of the illness could be a change in the DNA structure known as genetic mutation. Other causes could be air pollution, environmental exposure, or even mobile phone radiation, but these are highly contested.
Like a lot of cancers that occur in people as they get older, it's a case of the genetic mistakes accumulating as we get older. In the case of children, probably the most widely held theory is it's to do with the way the immune system develops in early life. What we do know from very, very good studies is that the very first step actually happens before a child is even born. There's a crossing over of little bits from two different chromosomes before they're even born, and that creates an increased risk of them developing leukemia. But not all children with that abnormality go on to develop it, so obviously something else is needed. And we think the most likely explanation is something to do with exposure to infection, although it's not absolutely proven. People often talk about power lines as a cause of it, but the majority of scientists working in this field think that that's probably quite unlikely, that it's a chance finding.
The treatment for leukemia could involve chemotherapy, radiotherapy, or even biological therapy with the use of interferon that works against cancer cells. But in some serious cases, a bone marrow transplant may be necessary.
For patients who do need treatment, the most important part of it is always what's called chemotherapy, the use of drugs to treat the disease. Bone marrow transplants, for those patients who need them, may be the only life-saving option, but they're actually used only for a minority of patients. Most patients can actually be treated without that.
We also asked what's the best advice to take to decrease the chances of acquiring leukemia.
There's only one form of leukemia where it's possible really to give much advice on avoiding it, and that's called acute myeloid leukemia. And there's evidence that maybe as many as a quarter of all cases of that are caused by cigarette smoking. Now the point is, anybody who hasn't given up cigarette smoking because of all the other health risks probably won't be impressed by that. For the other forms of leukemia, the only advice really that anybody can give is just a good, normal, healthy lifestyle which protects against all forms of diseases.
There are around 2,400 cases of leukemia diagnosed each year in the UK alone, with 85% of them occurring in children under the age of 15. The treatment, as well as the emotional stress that comes along with it, could be very devastating for many families, as the risk of death becomes the most worrying factor. The good news is, however, that continuous clinical research is being undertaken in order to improve the quality of life and to find better effective ways to cure the disease. Besides, 80% of children who have leukemia are completely cured. This is Alice Iskander for Good Morning KSA, Saudi TV Channel 2, London.